Living with diabetes means paying close attention to every part of your body, especially your feet. Diabetic foot ulcers are one of the most common and serious complications of diabetes. But with the right care, education, and expert help, these wounds can be managed and even prevented. Diabetic foot ulcers often develop in specific areas due to pressure, poor circulation, or nerve damage. These include the ball of the big toe, which faces constant pressure while walking, the heel, the tips of the toes, often due to deformities like hammer toes or claw toes. Between the toes, because of moisture and fungal infections. The outer edges or sides of the foot, which can be caused by rubbing against shoes, and under calluses or corns, which can actually mask developing wounds. What causes these wounds to form and worsen? Neuropathy or loss of sensation means you might not feel a cut or sore. Poor circulation slows healing and increases infection risk, also called vasculopathy. Foot deformities can cause pressure points. Skin under these succumb quickly and form wounds. Inadequate foot hygiene can lead to infections. And poorly fitting footwear create repeated friction and pressure. Wound care is crucial. It starts with the right dressing, which protects the wound, maintains moisture balance, and supports healing, and particularly offloading the wound. Common wound care options include hydrocolloid dressings, which are ideal for mild to moderate wounds, alginate dressings for heavily draining wounds, foam dressings, which offer cushioning and moisture control, antimicrobial dressings to help prevent or control infections, and hydrogels, which promote moisture in dry wounds. Each wound is different, and choosing the right dressing depends on the wound's depth, drainage, and infection status. This is usually done by an expert surgeon. Sometimes wounds don't heal with basic care. That's where expert plastic surgeons come in. Using their in-depth knowledge of anatomy, tissue healing, and advanced surgical techniques, they offer interventions such as debridement, which is the removal of dead or infected tissue, skin grafts, where healthy skin is transferred to cover the wound, and negative pressure wound therapy, also known as wound vacs, which use suction to remove the exudates, contract the wound, speed up healing in the wound bed by promoting granulation. Plastic surgeons can also perform flap surgeries, using nearby tissue with its blood supply to close large or complex wounds, and preventive surgeries, like tendon lengthening or offloading surgeries, deformity correction, etc., to redistribute pressure and help avoid future ulcers. These interventions aim not just to heal the current wound, but also to prevent recurrence and restore the patient's ability to walk safely. The best wound is honestly the one that never forms. Preventing foot ulcers includes daily foot inspection, checking for cuts, blisters, redness, or swelling. Proper foot hygiene is also important. Wash and moisturize your feet, but make sure to keep between the toes dry. Wearing diabetic-friendly footwear helps you avoid pressure points, and regular checkups with your diabetes and foot care team are really, really important. And of course, blood sugar control is essential for healing and your overall health. Diabetic wounds can be challenging, but with early care, expert help, and the right treatment, healing is possible. Always stay informed, stay aware, and just take one step at a time toward better foot health. For more guidance, talk to your doctor or consult a wound care or plastic surgery specialist. Your feet carry you through life, so take care of them.